Hello everyone, and welcome to our presentation of systemic lupus erythematosus. Systemic lupus is an autoimmune disorder, and while scientists don't know the exact cause of systemic lupus, they do know that for some reason homeostasis in the body is disrupted, and this causes the immune system to begin attacking harmless tissues in the body which they are supposed to be protecting. So now that we have a general understanding of what systemic lupus is, we will further dive into the topic to hopefully make sense of this beautiful comic to the right. While we don't know exactly what causes autoimmune disorders, we do know what risk factors are associated with it. Gender, for one, is a risk factor for systemic lupus, as it is 10 times more common in women than men throughout their reproductive years. Age may also determine your risk, as the onset of systemic lupus usually occurs from ages 15 to 45. Studies have shown that systemic lupus is more common in individuals coming from African or Asian populations.
In Canada, the prevalence of systemic lupus ranges from 31 to 52 cases per 100,000 people. According to the diagram, this range of cases is fairly low compared to other countries such as the United States. So now let's talk about what's gone wrong concerning the physiology of systemic lupus, or what we like to call pathophysiology. The onset of systemic lupus is triggered by environmental factors, such as viral infections, stress, sun exposure, certain medications, and increased level of estrogen, as well as genetics. Systemic lupus is characterized by spontaneously active T and B cells that are activated without a stimulus, and the dysfunctions of dendritic cells. This causes type 3 and type 2 hypersensitivity reactions that contribute to the creation of abnormal immune complexes and release of inflammatory chemicals such as cytokines, which cause symptoms of lupus. Let's talk about these reactions by watching this original video made by one of our group members, Delaney. Enjoy.
The symptoms of SLE occur because of type 2 and type 3 hypersensitivity reactions. A type 2 hypersensitivity reaction occurs when individuals develop antibodies because of their genetics that mark white blood cells and phospholipids for destruction. A type 3 reaction occurs when a cell is damaged. The cell undergoes apoptosis, releasing apoptotic bodies and genetic material into the ECF. Individuals with lupus have genes that increase apoptosis rates and decrease rates of clearance in the body. In an individual with lupus, B cells identify the parts of the dead cells as antigens and create anti-nuclear antibodies, as well as tell the T cells to attack them. The anti-nuclear antibodies attach to the antigens, and the complex is deposited in the connective tissues. In the connective tissues, the complement system, which gets rid of pathogens as damaged cells and amplifies the inflammatory response in the immune system, is activated. This causes lysis to cells in the area and inflammation, causing the symptoms of systemic lupus.
This is my cousin Crystal. She has been living with lupus for over 20 years. This photo was taken during one of her flare-ups. The three main symptoms of lupus are fever, joint pain, and a rash. The rash can cover the entire body, including the face, where it has been given the name the butterfly rash because of the shape it makes on the face, as you can clearly see in the picture. When cells are damaged by UV radiation, such as the sun, the malfunctioning immune system tries to clean up the damage to the skin cells, but instead causes inflammation, inducing a butterfly rash. She also experiences dilapidating joint pain caused by when antigen-antibody complex is deposited in joint tissues and the complement system is activated. Inflammation of the joint lining occurs. She also gets severe headaches and fever, which occur when macrophages and leukocytes think they are exposed to foreign antigens. They produce pyrogens, a substance that increases body temperature. Her kidneys have also been impacted by lupus. Lupus nephritis is the inflammation of blood vessels that filter waste. It also attacks the harmless tissue.
All right, let's summarize and relate this information back to our key concepts. Systemic lupus is an autoimmune disorder in which the immune system attacks the cell membranes of harmless tissues. The disorder occurs because of type 1 and type 2 hypersensitivity reactions, which utilize antibodies which are made up of proteins. Apoptosis maintains a homeostatic balance within the body and is essential for cell eradication. Systemic lupus increases this eradication, shifting the balance.
Here are some questions for you to try.
True or false? An individual who has a high number of autoantibodies in their bloodstream is likely to be having a type 2 hypersensitivity reaction. False. If an individual has a high autoantibody count, they are more likely to be having a type 3 hypersensitivity reaction. Fill in the blank. Lupus tends to be more common in who are between the ages of and originate from women 15 to 45 and people of African or Asian descent. Answer the following question. If an individual has an increased apoptosis rate which causes the attack of their tissue and organs, what type of hypersensitivity reaction is occurring? Type 3 hypersensitivity reaction. Answer the following question. What are the 3 most common symptoms seen in patients with systemic lupus? Fever, joint pain, butterfly rash.